Good afternoon, everybody. I don't normally speak at these things, so I'm going to keep this very, very short and sweet. As always, it's a privilege to be here with everyone as chairperson of Social Care Ireland, and I wanted to warmly welcome everybody to the conference. We're, as an association, as a professional body for social care, feel that this is a significant moment for us in our profession. The conference is always a moment for reflection, but we feel that we're at a moment of challenge as well as a moment of opportunity. So really I'm here to speak to you today about where Social Care Ireland stands, what we've been hearing from yourselves, our members, and how we plan to respond and how we are responding. And I suppose what we really want to figure out and to talk about is where we might be going next as an association, considering that the CORU registration board is open and grandparenting has closed. So the focus for us as an association has been on that for as long as I can remember, actually, but definitely for the last 5 years. So we really want to think about what's next for us as an association and how we might get there together. So the sector has undergone real and substantial change. The introduction of CORU registration has been an important milestone for us in the professionalisation of social care, what it represents, and for many of us it represents recognition. It represents the recognition of the complexity of the work that we do, the expertise that's required to do it, and the standards that we have been working with and trying to uphold every single day. It's been progress, but with progress comes challenge. And it's become very clear to us that many of us are feeling that. We have been listening to social care workers from across the country through emails, through the webinars that Charlotte has been running, through conversations, day-to-day engagement. We also recently shared a survey with all the members of Social Care Ireland and social care workers across multiple disciplines to better understand how we're feeling about the profession at this moment, the challenges, the concerns and the positives we see in your work. And Charlotte will be talking to you in a little bit about the survey, which is still open. There's an opportunity for everyone who's here in the room today to feed into that survey. So Charlotte will be talking to you about that a little bit later. What we want to do is make sure that the voice of social care is heard, to highlight the issues that matter most to you, and to make sure that we have a strengthened, clear, united message as we move forward together. We've already heard significant concerns about staffing, about professional identity, and we've heard concerns in particular around the recruitment of staff who are not eligible for CORU registration into what are traditionally considered social care roles, often are social care roles, but might just have a tweak in the title. We've heard that, I want to say that we share the concerns around that. We understand the seriousness of the issue. And I think it was very much reflected in the Ombudsman's report yesterday that was released in relation to some of the concerns that Social Care Ireland have been raising for the last number of years about care. For many of us, this is not an abstract policy debate. It's something that impacts us in our workplaces, in our teams, in our professional standing, and ultimately it's affecting the quality and safety of the care provided to the people who are relying on us. Many of you have told us that this practice risks undermining the very purpose of registration. It's creating confusion about roles, and it may devalue the qualifications, the experience, and the accountability that registered social care workers bring. I'm sure a lot of people are now asking what are Social Care Ireland doing about it? Well, we haven't been passive and we have acted. On the back of our concerns raised by our members, we have written to key political representatives highlighting these issues. And we have secured a meeting with Minister for Children, Disability and Equality, Norma Foley, in the next couple of weeks. And we see this as a critical step, but a starting point. It's the opportunity to bring our concerns directly to the highest level of decision making. It allows us to advocate clearly and strongly for the integrity of the profession, for appropriate workforce planning, and for policies that support and not undermine registered social care workers. We know that one meeting won't solve everything, because change takes persistence. It takes evidence, and above all, it takes a strong, united voice. We want to make sure that, building on what David and Felicity said this morning, that we're holding the government to account, and that's where we want to start. We've not only written to political representatives, we've been advocating out in the media, we've written articles, because we want to make sure that the crisis in care, us as care recipients, as caregivers, is acknowledged at the highest levels of government. So I suppose this is where we all come in. It's not in the name of Social Care Ireland that the strength comes. It's not about our history. It's not about structure. It's about the membership. And when we think about how many applications have been made to CORU for registration in the last number of months, we have over 20,000 people who have applied to become social care workers. So John mentioned 1,500 being a big number earlier, but actually if you think over 22,000 is an even bigger number, we will be one of the biggest health and social care professions in the whole of Ireland. Now, not everyone who's applied will be eligible to register. However, that's a huge amount of people who see themselves as engaged in the practice of social care. So while it's changed the landscape, social care registration, we need a very clear professional identity. It's setting standards. It's opened that door for stronger regulation, better regulation and accountability. We see that at this time, perhaps more than ever, that need for that strong representative body. We want to be a loud, clear and unapologetic voice for the sector. But to do that effectively, we continue to need to grow. So we need to grow our membership so we can grow our reach. We need to grow our collective influence. This is where we're asking everybody to think about how to be an activist. So this is where we're calling on you to make sure that we have the numbers, because in any professional landscape, those numbers matter. The more people we represent, the stronger our mandate. The stronger our mandate, the greater our influence. And the greater our influence, the more we can actually achieve for ourselves, as professional social care workers, and for the people that we support, most importantly. So it's not just about membership numbers on a page, it is about unity. So I'm asking everyone today to consider the role as an activist for doing that, because that matters. If you're already a member, thank you, because your support absolutely matters. If you are already a member, I'm going to ask you to think about being an ambassador as well, to encourage your colleagues, your teams, other people in your networks to join. And as we move forward, our priorities are clear. We are going to continue to advocate for the integrity of what CORU registration means. We will continue to challenge practice that undermines those professional standards. We will continue to engage with government and policymakers at the highest levels. And most importantly, we are going to continue to listen to the voice of social care, to you. Your experiences, your concerns, your stories, your ideas, they're not only important, they're vital, they're essential. Again, before I finish, I just want to thank everyone for being here with us, for continuing to connect, to debate, to start the conversations, and of course for the work that you're doing every single day. We know social care work is not easy. It's complex, it's demanding, often under-recognised. As I think we've acknowledged this morning, all sorts of types of care are. But it's also deeply, deeply, deeply meaningful. We support individuals through some of the most challenging moments in their lives, and we as social care workers, we advocate, we care, we empower, and we do so with professionalism and compassion. So as you move through the rest of the conference, through the discussions and the workshops and the conversations, I encourage you to engage, to connect, and to reflect the role that you can play as an activist in strengthening our profession. Together we are stronger, and together we will be heard. Thank you very much.
Hi everybody. Thank you for that Chair's address. I think that just speaks to everything that we've tried to achieve today. My name's Charlotte Burke. I'm the CPD Coordinator. I'm also a PhD candidate. I'm writing it up at the moment. Woo-hoo. Hopefully I get there in the end. So look, it's so exciting to see this room. We were here last night and putting rooms together and going, my goodness, look at the size, and nearly every chair is full. So well done. Thank you for turning up today. We really appreciate it. We have 360 delegates, the biggest so far. We have 39 exhibitors outside. You know, the energy that you can feel from everybody, that's what we wanted. We wanted to provide opportunities for people to network, and we can really see the value that you place in attending something like this as well. So that gives us a little buzz as well, that we're hoping that we're meeting and that gap, I suppose, of why we're all here together. So we really appreciate that, and a big thank you. And that connection, I suppose, is so important. And that theme has been kind of following us out throughout the whole day of how important it is. And I've seen people outside going, oh, I haven't seen you in 20 years, I haven't seen you in a few years. And just making those connections again, you can really see that we are actually a community. But sometimes we're in our little silos and we just have to make those connections and make the efforts to come to stuff like this. So we really appreciate that. I'm not going to keep you as long, I promise. I do have a couple of videos for you as well. Let me just... one sec. It's frozen. Yeah, sorry now. I just come out and go back in. Yeah. Excuse me one sec. Ta-da. Brilliant. Same one again. Hold on. Yes, deadly. Sorry. Okay, so I'm just going to do a little bit of a whistle-top tour through some of these topics. They're obviously very big topics. And, you know, we're delighted even to have CORU here. So if you have questions on this, they're out there, exhibitors. They're delighted to answer those questions. So I'm just going to give you a little bit of update what we've been doing so far, and then kind of touch on some of these. But just to say as well, that's my job now, is to just focus on CPD. That registration is done. It's only the new graduates that have to continue that. So we're delighted that our focus is going to be on professional development and all that comes with that. This is just to kind of highlight what a year we've had. Like Leanne has already said, we had just under 22,000 applicants. A lot of them came in the last week. So be patient. There's a lot of work the crew have to do to go through all of them. But we do have 4,835 registered since January. So that's amazing. When you compare it to social work and physiotherapy, they're just under about 6,000. So we will be the biggest, as Leanne has talked about. So that's pretty amazing. This was a competition we had. So thank you, everybody, for sending in. We couldn't give everybody a prize. We had so many pictures in. But the OTC won this prize, and I actually met, well done, ladies. And I met Lauren, actually, and I think they donated their prize to charity, so thank you for that. And again, I'm just going to show you a couple of the ones. I couldn't put them all up here. That was just another one. And this was just to celebrate the closing of registration. What does that mean to you? I think somebody here actually has their registration, their application letter in their hand. They finally got it and went through all of that process. So that just gives you an idea of just, again, it was just something fun to try and just kind of give a bit of energy to something that can be a bit arduous. So the code of professional conduct and ethics, this supersedes any other code that you have with your employer. So it's really important that you get your head around it. I'll just pull out a couple of sections. Section 9 is all around your scope of practice, your skills and knowledge, what competencies you have. So again, you need to start looking at that going, okay, am I within my scope of practice? And I suppose a very simple example I can give you, I worked in the disability sector for 20 years, and we used to give out medication, so safe administration of medication. I'm not a nurse, social care worker. I would have gotten additional training. I would have been assessed in the unit I was giving out medication. I wouldn't have been allowed to give out medication everywhere else. So there would have been perimeter set, so that was safe practice. So it's still within my scope of practice and my skills and knowledge, but I'm still adhering to a code, if you like. So if you are doing something or you're kind of curious about going, do I have the skills and knowledge? It's really important to look at that and see, is there additional training or supervision that can really make sure that you are working safely within that. That's just section 9. That's about your accountability and responsibility. Section 10 is about the CPD. You must engage in continuous professional development, and you should keep a record. So that's where, I suppose, your CPD coordinator comes under your professional body. That's what I'm here for. And as under all professional bodies, there's a continuous professional development. officer. So we come together and run interdisciplinary events or discipline specific, and we get a grant for that. The other one under the section, I just want to draw your attention to section 17, which we did get a bit of feedback from our members. It's a bit more contentious around supervising tasks that you delegate to others. So we got to think about this one, and we have to kind of think, okay, if I delegate a task to somebody else, who's responsible for that? And you got to start thinking about that. Are they being supervised adequately? Have they got the right training? So if you delegate a task, there's a responsibility on you as a registered social care worker. So we need to look at that one in a little bit more detail. That's section 17 of the code. Then, let me just check this. Yes. So the next piece I'm going to just jump into briefly again is around fitness to practice. And I suppose the way I look at it is everybody, and this young lady here, so I use this picture, they have a right to complain. Everybody has a right to complain because they're seen as a consumer. You're providing a service. So I suppose we just have to kind of think a little bit differently rather than Big Brother's watching you and I'm in trouble and there's going to be blame. We have to, as social care workers, we're chameleons sometimes. We just work with what we have, and sometimes we have to just go with the energy of the people we work with. But once you have accountability and decision making in there and you can articulate that, you're perfectly fine. So all fitness to practice it means that CORU's main aim is to protect the public. So it means anybody using a service has the right to complain. There's threshold levels, and if was a complaint made against you, you are brought in for a preliminary hearing in Smithfield into their offices, in CORU's office. And then you have the right to defend yourself as such. But what will be sitting on the table is the Code of Professional Conduct and Ethics to say you're in breach of this is where the complaint fits. So that's why it's really important to understand your code. We are going to be doing loads of workshops on these, and CORU are going to be doing them with us as well, and we'll record them and keep them there. So important, depending if you're a manager and a complaint comes in or the complaint comes in against you. I know there's many moving parts, but again, CORU don't want every complaint that's made against employees. It depends on the seriousness or the outcome of the disciplinary procedure within your employment that CORU may be notified or not. So it's not every time there's a disciplinary that CORU need to know about it. It depends on the seriousness and the outcome of that disciplinary procedure that you may notify CORU. So again, just touching on these subjects, that's just a little... The vetting is gone when people are... So the new graduates won't have to send in vetting. It's only for self-employed, people who are self-employed, they'd have to do that. So that's the only change, really. There's the state of the register, if anybody's into that. There's lovely statistics there from CORU, and it gives you a nice flavour of the 12 that are registered to date, you know, and what's going on for CORU at the moment. We will be offering fitness to practice insurance. Again, we're just looking at that and trying to get the best price. So that'll be part of the membership package, that you can have it as an add-on, if you like, and avail of it. So I don't have enough on that yet, so I'll come back to you with more information on that. So the CPD this is the bit I love. So this is just having a curiosity about your current practice and then where you would like to go with the clients that you support. So it can be, we don't have to overcomplicate it. It can be informal or formal. Formal meaning going to a conference. Informal can be the chats that you're having outside with colleagues or people that you haven't met, or you're discussing what you heard earlier on with Felicity or David, or even what Leon has been talking about, and you're having those chats and it influences your thinking or it changes your perspective. If you capture that and write it down and reflect on it, that is CPD. So let's not overcomplicate it, but we are going to run loads of events. We're doing in-person reflective practice. We're doing supervising events as well. I'll just throw these up here. So this is some of the stuff that we're coming up with. So Nicola's going to do a level 1 supervision. And then anybody that does the level 1, we're going to do level 2 workshops. And again, it's just to kind of challenge people to think, what are the barriers? What is going on for supervisors as well as the supervisee? And how difficult and challenging it is sometimes in those areas. The Reflective Practice Day, we've ran about 3 of them so far. I love them because they're in person, and it's through the lens of group work. So you get a chance, you can bring something to that, and then have the chance to kind of discuss that. Yeah. And you have the chance then to discuss that in groups and then come back as a larger group. I've been part of them, and in the morning it's so quiet, and then by the afternoon everybody's chatting and just adding bits to it, and it just gives a lovely energy to people feeling, oh, this is what reflection is. I'm actually doing it. It's experiential. So, and that's what we wanted for those. Let me see. So we got 35,000 euro from the National Health and Social Care Professionals Office this year again, which is great to get that support to run these events. So for you guys as well as members, it's really important that the fourth quarter of the year, we send out a survey looking to see what are the gaps in skills and knowledge. I'm 9 years off the floor. So as well, you know, we need people who are frontline telling us, this is what's going on, Charlotte, and we'd love to have a little bit of CPD around this, and we feel other people in the sector might value it. Brilliant, that's what I need, and I will go off and find facilitators and rooms and organise the rest. That's my job. But it's really helpful if you can help me get that information from you guys. It's so important. It just really benefits me and makes my job much easier, because I know then if we put something on, you guys are going to attend it. And then because we get funding, they're usually free or a nominal fee if they're in person, because we don't get funding for venue hire and stuff like that. It's just for the facilitator. So very excited to have Dr. Karen Treisman. She's such an amazing facilitator, and we've always had her online. She's actually going to be in person at the next Disability Special Interests Group Conference. That's on the 28th of September. So we're absolutely delighted to get Karen to come and do that for the day as well. So we can make things happen, I suppose, but we have to collaborate and, you know, and share that with me so that I know, okay, is this something that I could put out to the broader sector and see would there be an appetite for it or an uptake on it. This is just around CPD. I just put that up there as a joke. You handsome academic you, not that sort of deep reflection, does say Dave. So we're looking for something a little bit, you know, it's a bit deeper than just planning, action. It's like, well, how did you feel about it? Is it working? Could we do it better? Could I share that with my colleagues? So that's all reflection is just taking those moments to sit and pause and think, okay, could I share this? Could we change it? What happened? What was the antecedents? You know, the stuff that you do anyway, but we're so busy. And what's happening is when people are so busy fighting fires, they actually have less time to reflect. And then there's a higher probability of practicing defensively or not, you know, having your blind spots on and not actually seeing what's going on for the people that you support. So the evidence is there to say the busier you are, the more you should reflect. So it's really push back on services to say, is there scope within your working day to have moments where you can reflect? You know, at handovers, at supervision, you know, before you start your sleepovers, you know, so having it in your documents, and sometimes you can't do it right now, but you might say, look, I'll come back to that. So planning it in the diary. It's a structured approach to your professional development as well, which is so important. The credits, so this is just some links to some of the stuff that you can, what's that say, 10 minutes? Sorry. I need glasses, sorry. So I'm going to show you two videos. One is 4 minutes, and it just gives you the whole CPD piece rather than me trying to go through it all. These are some links that are on our webpage, really useful, short little booklets to download. They're on the CORU tab on the Social Care Ireland page, and obviously on the CORU page as well. There's giving you templates, and all different reflective cycles are on that there. So let's see if this plays. It's just 4 minutes.
As a health and social care professional, continuing professional development, or CPD, is the way you can maintain and improve your knowledge, skills and competence through various types of learning. And it's not only formal learning like courses and modules. It is in fact any form of learning that contributes to your professional practice. As part of your own Code of Professional Conduct and Ethics, keep in mind that you are expected to achieve 30 credits of new or enhanced learning in every 12-month period. You might think that 30 credits sounds like a lot, but you're probably already doing most of that as it is. And that's because there are lots of tasks, practices, or activities that can be counted towards your 30 credits of CPD. These include supervising a student on placement or participating in supervision, reading professional publications or other relevant material, reflecting on an interaction with a service user or a particular case, learning about new technologies, reviewing policies or procedures. As you can imagine, there are so many examples, and it's almost impossible to list them all here. Remember that here at CORU, our CPD system is very flexible and it recognises lots of different types of learning. And if you can't see an activity you have completed on this list, do not worry. The list here is by no means exhaustive or complete, and it is more about suggesting some examples. So just because you didn't see your activity just there, that does not mean you cannot count it as CPD. No two jobs are the same, and our approach takes into account the different needs of people in all health and social care professions at different stages in their career. The main thing to remember is that you can choose what learning activities are right for you. And if it results in new or enhanced learning for you, then it qualifies as CPD learning in our eyes. Let's take a closer look at two different types of learning that can be recorded as CPD. 1. Planned learning is any activity you undertake where you expect to develop knowledge or skills before you begin. That includes anything like going to a conference, taking a course, or a formal meeting to discuss something with colleagues, for example. 2. Unplanned learning happens when you learn something or gain a greater understanding of an issue without any prior thought or planning. This might include watching a relevant TV show, doing internet research, or even chatting with a colleague over a coffee. When you think about it, you have almost certainly benefited from both planned and unplanned learning many times through day-to-day activities. Keep in mind that when we talk about a learning activity, we mean any activity that contributes to the development of your knowledge, skills, and competencies as a health and social care worker. And each and every one of these can be considered CPD. Just remember that the learning must be relevant to the needs of your service users or your employer, or both, and can be applied or will contribute to your practice. Ask yourself, can you apply what you have learned to change or improve how you work on a daily basis? Have you learned something new that confirms you're already taking the best approach in a given task or situation? And finally, how has any learning, planned or unplanned, helped you provide a better service to clients and patients? It's a good idea to reflect on these points so that you can show how learning has helped you in your work and career over that all-important 12-month period. And one last thing, as a health and social care professional, it is your responsibility to keep a full record of your own CPD. When it comes to all things CPD, if you have any queries, we'd be happy to help. Our comprehensive frequently asked questions section on CORU.ie will probably answer any questions you might have. If you can't quite find what you're looking for there, feel free to send us an email to cpd@coru.ie.
Okay, kind of says it all in a couple of minutes, doesn't it? I know that's only just one little, but I mean, that's a good place to start. And then just to say, as part of your professional body, that's a role that I can do. I've gone out to organisations. I did it for preparing for registration. I can also go out and share all of this and give it a little bit more detail and do workshops out in your organisations. Just email CPD@Social Care Ireland, and we can arrange that if that's something you think would be of value. We're going to be doing them online as well, in person, whatever works. This is the survey that Leon was talking about earlier on. Really important that we know what is going on for you, so we know what to advocate on. I won't get into it, because I think Leon just touched on everything earlier on. But again, we've got 360 respondents. Like if we go to the minister with 700, 800, I mean, it just gives a better punch. If everybody here today, on top of that, we would get to our 700. So please, if you take just a few moments, it only takes 3 or 4 minutes to try to fill that out. It's on our website, but that's a QR code for it there as well. We'd really appreciate that. This was so the social ability group. Again, I was just giving you a bit of a review of what we've been doing for the last year. I just love this picture. This was actually not last year, it was the year before. And this is Anya Flynn from the Decision Support Services giving a talk the same time that Finian Reedy is from the social ability group was giving a talk as well. So, I mean, that's what it's all about. And it was all about advocacy and the assisted decision making. So, Social Care Ireland have been supporting this social ability group for the last 5-6 years or something through lottery funding. We've Josephine McLaughlin, so you've probably heard me talking about it over the years. So we're so excited that at this stage now you can see how important being a self-advocate is, that Finian is now up telling us what it's like to be that person and to advocate for himself. And they're working on different projects and stuff. So I just thought it was a lovely picture to share with you, to show you how things have progressed with the social ability group that's in Carlow and Kilkenny that Social Care Ireland are supporting at the moment. And this is just some from the conference this year. That's the Disability Special Interest Group over the far side. I just wanted to congratulate them again on the successful conference. And this is everybody at a workshop doing some reflection as well, so they can be very interactive. This is another project that we're involved in. Dr. Denise Lyons, Dr. Teresa Brown, Dr. Vicky, I can't remember her second name, I'm so sorry. So there's a couple of us on a committee. Helena Doody is another one. Came together, and it's been funded by David Doherty. So a big thank you for David for really incentivising. This came about at the conference last year, actually, and we felt that you were hijacked. You were. You actually got to sign a napkin, I think, pledging to the finances. But and you were true to your word. And so we were able to come together as a committee and say, well, how do we show the diversity of the settings that are social care now? Because we started off in residential care and we now work in so many areas, and it's, you can see that in the room. So we felt from an education perspective, how do we teach students that? They only get 2 placements, maybe 3. So how do we show them, this is so much going on? So that's what was the brains of this idea, to see if we can put some videos together. And we're going to do 10. I think we've 6 in the making. We've 1 completed at the moment. I'm editing them now as well. It's one of my jobs now. I never thought that when I started this role I'd be doing that. But anyway, it's great crack. 5 minutes. So I'm going to show you a little trailer of the first one, because we're launching it here today. And it's in Fresh Start in residential care. And the second one is in Platinum Clubhouse, which is a mental health recovery programme. The third one is in a domestic violence place in Athlone, Esker House. We're only recording that actually last weekend. So there's going to be 10 in total. And this is just the one. So we're very excited about this, to have this launched and have this ready. So again, this is another 4 minutes.
Hello and welcome to the Fundamentals of Social Caring. This is an educational documentary series where we visit social care settings throughout Ireland to learn about practice. This is episode 1 and we are learning about children's residential care. Today we are going to visit one of those private residential care homes, and this is Fresh Start. And Fresh Start have services in both Munster and Leinster, and we are going to the Leinster service to meet the staff and learn about social care in children's residential care.
So a young person moving in would probably feel quite scared and alone, so you want to make the house inviting, you want to make their space comfortable, so you want to get their input into decorating the room, you want to find out about them and create spaces in the house that they feel comfortable in.
Most residential jobs, if you come on shift for a 24-hour shift or a day shift, you'll be part of a handover, which will consist of care team members from the previous day They will hand over the information regarding the plans of the young people yesterday and what they did, etc. So that communication is really important to your day.
We actually do a deep clean on a room every single day. So on Monday it might be the sitting room, on Tuesday it might be the kitchen, on Wednesday it might be the downstairs bathroom. We have to make sure that the house is spotless every single day for these children.
The more small, consistent actions you can build up with the young people, the better the relationship is. Ideally, what you're trying to do is build relationships up naturally with the young people, but letting the young people know that you've heard them, that you're acknowledging them, and that their voice ultimately is being heard.
Communication is really important as a social care worker, and how you communicate with everybody will be very different. How you communicate with the young people, how you communicate with your colleagues, and how you communicate with professionals involved in a young person's care will all require a different method and a different way of communicating. Getting to know your young person and communicating with your young person is really, really invaluable, because when you build up a relationship and you get to know your young person, you'll understand what triggers them, what upsets them, understand when they're a bit off, when they're not having a good day, and how to support them.
Also in place would be risk assessments for young people, ensuring that they're safe at all times, to be able to assess what risks are there and to be able to kind of reduce those risks and eliminate them if at all possible, so that we're working in a safe environment with the young people.
I suppose a big part of a team is for everyone to be included and realising that everyone plays an important role. Little things that you can do for one another, whether it's making a cup of tea, a sandwich, you might have a tough or busy day. And it's minding one another. You're taking on a role, it's a responsibility. You're going into a house to work with young people. It's being resilient and putting in a commitment that you're going to work in the house with them young people. Things can get tough at times. You pull through it together as a team. We need to be aware of our own triggers. We are human at the end of the day, and things will get to us, but if you're aware of what gets to you, you can work on it.
All right, Max.
Fucking starving.
All right, Max. Well, I'm going to put on some rasher sandwiches because I know that's what you love.
Yeah.
All right?
Good. Yeah.
Cool. You give Chloe a shout, see if she wants something.
Chloe! Do you want some food?
Max, I could have done that.
Yeah, okay. Quickly now, I'm starving.
All right, it's coming up. Chloe, do you want something to eat?
Eggs.
Eggs. Poached, fried, scrambled?
Poached.
Poached. Max, do you want some eggs?
Fried.
Fried. Yeah, I'm going to cut up some mushrooms as well. I'm going to pop out to the office. I'll get the knife. All right. Do you want to work away on the eggs? Make a start. Brilliant, lads. Thanks a million. I'll be back in a second, all right?
Every week we'd have like a weekly menu. We all sit down and have dinner together. The staff would make the dinner, but if someone doesn't like something, they always make them something else.
The best advice for me would be like building a relationship with young people. If you're not really willing to build relationships, and then they don't actually last that long in the job.
The biggest thing for me was, can I trust you? Are you just going to go when I tell you something? Because you get close to so many people because of what you went through. Just talking about it, and then out of nowhere they are just gone.
Okay. So I meant to say as well that the actors in it, they're child actors are in that. That's not actually the residents. But then at the very end, we did interview some young people that were in care, and we asked them what was it like. So when you see the quotes at the end, they're being read out by the actors, but they're actually real quotes from children that have been in care. So that's just a taster that will be available for everybody on our website, or it'll be around all the social care programs around the country will be using it, because it's a tool for students, I suppose. So hope you liked that. We are going to do a workshop tomorrow morning where we're going to show the whole video and then maybe have a discussion to see what's your setting like. Is it different to this? And could we have a bit of feedback on, did we actually capture everything that goes on in a residential care unit? So we will have that tomorrow as well. That's just our membership there. So important. The more members, we can't reiterate this enough. The stronger our voice is, the more members we have. It's as simple as that. And like that, if we can go back to the minister with 700 people said this, it's just much stronger the more people that you have behind that. This is just the Curam magazine. This is my last slide, but I just wanted to, Jennifer McGarr from TU Dublin, Tala campus. Do you want to just talk about the Curam magazine?
Hi everyone, my name is Jennifer McGarr. I am one of the board members of Social Care Ireland. I sit on the Irish Association of Social Care Educators, and we form part of the board there. So just wanted to really take a moment actually to talk more broadly really than Curam as well. At board level, every year after the conference, we often reflect on the amazing array of workshops and presentations that have happened over the last 2 days. And sometimes you're dictated according to how many people can get into the room for the number of people that actually get to experience that. Leon, our chair, mentioned when she gave her address that we're trying to ensure that the voice of social care is heard. And, you know, we're really keen to increase publication from practitioners so that the practitioner voice is really to the fore in terms of our kind of field of practice. And I guess as we move into this kind of regulated space, we are at in a new space in relation to this. So there are a couple of options in relation to that. Tomorrow, Christina Sieber, where's Christina? There she is. She's offering Christina is one of the editors of Curam magazine, which is obviously the Social Care Ireland magazine. She's offering a workshop for anybody who might be a teeny bit interested or curious about translating what they've done at the conference into some sort of written format. And, you know, there's a lot of flexibility around that. You might be interested in a reflective piece, in a kind of an opinion piece, or some sort of case study or something like that. So, I mean, don't be put off if you're not interested in the more formal publication route. Curam is really informal, and Christina will work with you in the many kind of outputs that you could generate from that. But just to say, there are more formal publication routes if people are interested in that too. I'm happy to stay back after the keynote this afternoon in this room. If anybody wants to talk through any of the possibilities, we've quite a number of journals that publish quite a lot of social care related articles. For example, we have our Journal of Social Care, editor Martin Powers somewhere in the room. We have the Irish Journal of Applied Social Studies. So there's lots of possibilities around producing outputs so that other people can get to see the fantastic and amazing work that people are doing here. So if anyone has any questions or even just wants to talk anything through, just stay back after the keynote and have a chat with me. Or if any of my colleagues who are active in this space want to support that piece too, I'll just be here. Thank you very much.
Thanks, Jenny. Thanks, everybody.